ago.
We've both been very impressed.
Amazing.
Very impressed.
Amazing.
It was undeniable.
And I find this very, very, very exciting.
I was intrigued by how it would work on a functional basis. I was also intrigued by how small and easy it is to use as compared to the lasers you and I have used over the years.
Absolutely. I love it that I can stick it in my pocket and get to the horse without wearing myself out dragging large pieces of equipment around. But at the same time, I think it's got plenty of power. It seems to have power enough to affect a metabolic change. That's what we're looking for. On the other hand, you can keep it in one place a long time and it doesn't activate a pain response or run any risk of burning tissue. And that results are vitally important, but safety very important too.
Above all, do no harm. So we've both been very impressed with this laser, and I think certainly it's something that we'll see a lot of use in equine physiotherapy in the future. And Mimi, thanks a ton for doing all your good work here at the WEG.
Thank you. It's a great pleasure. Real satisfying thing to do.
My name is Dina Kirkpatrick. I am a professional barrel horse trainer and clinician. My years of experience in this business has taught me that the most important job that I have is to keep my horses healthy and comfortable. My vet and I both agree that laser therapy from the Multi Radiance MR4 ActiVet laser is the way to go. It is very safe, it's easy to use. I've had my laser for about 1.5 years. I have used it on everything from cuts to muscle soreness. I have seen wounds heal twice as fast. These days, it's such a tough competition world that we live in, and the best way to get to the winner's circle is to give your horses an edge, and this is the way I help mine get to the winner's circle.
I was so impressed because, of course, he started out like this on the board, and I'm not able to rock his pelvis, and just watching him release that tension and watching his eye and then watching the flexibility in the muscle was really amazing.
It was undeniable.
Yeah.
The relaxation response is step one, and I'm always so gratified to see that because that's a direct indication of endorphin response. So we've had a horse that stands looking out his window with kind of a faraway look and in a bit of an anxiety state, go into a complete deep relaxation state. But then he gave us that nice spontaneous stretch, and that is golden. It proves that you've had a total systemic effect, not just local.
Particularly like about this one is something that my other lasers didn't have, is the fact that this has a blue light. And when I was first told about this, I didn't believe the potential of it. I did a lot of study on it too. I don't believe in just taking what someone tells me about a product. I have to do my own research. And the fact that it can be used to for antibiotic resistant bacteria is huge. This is going to be the future.
We're all old-fashioned around here. We've been haying oats and just, good feed and give them time off when they need it, but that ain't quite enough. And in the last 10 years, it's changed immensely around the barns. It's amazing how it works. I mean, I still not 100% on how it works, but it does the job, and my horses love it, and we've had good results.
If I had not had the ActiVet therapy laser, it would have put me back at least 1 year to 1.5 years. And what that looks like on paper when it comes to rehabilitating a horse is it looks like thousands of dollars.
My vet did not believe in laser at all. I mean, there's no question about it. After, I think it was maybe 4 treatments, she showed him the videos, and then I seen him and talked to him, and he said that he was very impressed with the progress that she has made with him, as am I.
It's been unbelievable, the progress that she's made. She now walks on all 4 legs, she puts her weight on it, and now we're going to go back to a maintenance where we come in every other week for a session.
And Colette had double ACL surgery, and so as a problem of that was that she put on some weight, and then she started shifting her weight. And so she was lifting up the front left paw. So we started doing the laser. And as you can see, she's standing on all four, and she's even going for bike rides with me now at night, and she's doing wonderfully.
And we can use dry needle therapy, but for River, who doesn't like needles, and rather than having to sedate him and then use acupuncture, it's best for us to use something like the MR4 active laser with the trigger point tips applied to the laser to allow us to focus in on certain areas just like we have here to help alleviate this pain. And truly, it is as simple as what you see now. When you first apply it, there's no doubt the horse shows a little bit of discomfort as he reacts to the pressure of actually having the glass bead on that spot. But you see that they slowly start to relax to the pressure, kind of like a fulcrum you would normally have during a massage therapy session. So we just leave this on here. For him, it seems to work out quite well for about 5 to maybe 7 minutes or so of therapy. And so if you saw earlier in the video how reactive he was and how much the muscle was quivering at the time, so now we'll come back through and press down as hard as we were last time in that spot, and you can see that the trigger point is no longer active and we don't have the muscle crawling and him trying to kind of walk away from us. So it's one trigger point in a multitude of different trigger points along his back, but it's just one classic example of how you can actually treat these trigger points without having to use dry needle therapy, and the horses respond to it quite favorably.
And so this is on 5,000 hertz, and we're using it for superficial sterilization and also as a numbing effect is what we're after. Using the blue light for its antibiotic properties because it's in the ultraviolet frequency range, and the red light is pulsing at higher frequencies of 5,000, so it acts more like an anesthetic, and that's going to help us to just moderately sedate and be able to patch him up. And we're already helping her with a laser stem, and basically what it is a combination of different lasers, an electronic pulse and a magnet in this MR4 laser system, and we're going to put that over the nerves and over the regions that are hurting for a couple of reasons: to bring down inflammation by causing a vasodilation. We're attempting to bring in oxygen flow. We're also attempting to numb out pain by using faster pulse rates than what nerves usually conduct at. And we've had some pretty remarkable results using a combination of our radio frequencies and the MR4 along with electro stimulation. We use several electromagnetic devices in our practice, and we found that this MR4 laser seems to fit the bill as far as giving us depth of penetration. Also safety. We preferred it because not the lack of necessity for wearing eye gear like you would on a class 4 laser. Basically, I prefer the 1Bs because you got as much punch doing the same thing with a lot more safety to the staff and to the animals.
The class 4 lasers are very, very expensive. They generate a lot more heat. This laser does not generate heat, so I don't have that thermal burn situation. And it also has the power with the super pulse, which does exactly what I need it to do. So I don't have to go out and spend a big sum of money for a class 4 laser when this laser will do exactly what I need in my practice. The thing I like about the MR4 is the laser stem, which has the light laser plus the E-stem, so I can get E-stem electrical stimulation at the same time as therapeutic ultrasound. This serves my purpose in wound healing and pain management without the fear of doing any thermal burns. If you're looking to purchase a laser, this laser will save you money and do exactly what you need it to do in your veterinary practice.